Hi, and welcome to the Focus on Eye Health Expert Series. I'm Jeff Todd, CEO at Prevent Blindness. Today, we'll be talking about health disparities through the lens of diabetes-related eye disease with Dr. Kristen Nwanyanwu, Associate Professor of Ophthalmology and Visual Science at the Yale University School of Medicine. Thank you so much for being with us.
Thanks. It's awesome to be here. It's a nice opportunity to be with Prevent Blindness and to be able to participate in the awesome work that you all do.
Well, Prevent Blindness is a patient advocacy organization, but we also know it's so important for individuals and patients to be able to advocate for their own health. Could you talk a little bit about ways that people can do that?
So I think the best thing to do when you're in a health setting and advocate for yourself is to make sure you understand what is going on. And it's a hard dynamic because especially doctors, sometimes we get to talking and all the jargon comes out and it sounds like muck, right? So advocating for yourself in those settings means, let me make sure that I understand. Or, what do I have to do because of this? Or, restating what your doctor is saying or asking for some materials at the end and not being afraid of that. And then also, if you have a provider that makes you feel ashamed or like you shouldn't be asking, don't be afraid to try to find another one. There's a lot of loyalty to doctors and other things because they always have been, but I always advocate, and even to patients that are seeing me, that if there seems to be a disconnect, that's why there's more than one doctor. Now, some of our rural settings, there's not, and that is just available, what is available. But even in the advent of telehealth and being able to connect in different ways, we're now seeing other opportunities to get that information. Also, using trusted information. So the Academy of Ophthalmology, Prevent Blindness have a lot of resources that give the basics in plain language about what is happening with eyes. And those are really trusted resources. I want to just say a lot of times you can go and play Dr. Google and it gets really scary really quickly. So you want to make sure that you have a trusted resource that you're reading on your own and understanding. But, don't be afraid to say, okay, let me just make sure that I can tell you what you're saying is happening so you can restate what is going on. I think also inequities are really important to see. And then if you see that, or if you feel that, to say something. Healthcare systems have an obligation, if they get federal funding, to provide equitable care. And so they do care if you are experiencing something that you think is different or you think that is that is inequitable based on your race, your religion, however kind of discrimination that you are feeling. And that is very important to be able to report. I think another thing for advocacy is that we think of health as unrelated, but we're saying today how close policy is related. So if you've had an experience where you need to access your health, connecting with your legislators is really important. Writing to your state senator, writing to your senators, writing to your representatives about what's happening in healthcare is really valuable. They have to listen to you. You put them there. And because right now we're at the point where the election's coming up, I don't remember when this is coming out, but you got to vote. And so you have to make sure that the people that you're putting in office will advocate on your behalf. And you can read about their platforms. They have to tell you. And so if it seems like what they're advocating for healthcare doesn't align with your personal values, then you got to pick the other person.
Thank you so much, Dr. Nwanyanwu. I really enjoyed these conversations with you and just look forward to having more in the future.